are identified. The method of collection includes the oropharyngeal and nasopharyngeal swab, anterior nares or nose swab, or the saliva test developed right here at Rutgers. In all cases, a PCR, a diagnostic test, is recommended. When the specimen is collected and transported to the lab, which now there are many labs available who have capacity, all results, positive and negative, are reported to the local health department and the communicable disease service at the Department of Health. Additionally, the ordering physician and the individuals are notified. Within 24 hours, a case investigation begins. The goal is that 90% of all new positive cases are contacted within 24 hours for a case investigation and contact tracing to begin. Contact tracing is the process used to identify those who come in contact with individuals who have tested positive for a communicable disease. This process is routinely used in public health to quickly identify vulnerable populations that are at risk and to ensure that transmission is halted or reduced. Through interviews, identification of close contacts who have been exposed to the individual are either tested or identified for symptoms. Since the beginning of the epidemic, testing of symptomatic individuals in high-risk populations have been taking place. For example, in long-term care settings and assisted living, of a total population of approximately 90,000, we know that 26,476 individuals have been tested and identified as positive. Universal baseline testing has been completed at 16 facilities in the South by Cooper University Hospital, and 76 additional facilities across the state are being tested universally this week. By the end of the first week of June, we are planning to scale universal testing throughout the state. Additionally, today, I am signing an executive directive that will require all long-term care facilities to supplement or amend their current disease outbreak plans to include COVID-19 testing, a plan for all staff and patients and residents. The plan must address testing procedures, frequency, post-testing protocols, and return-to-work protocols for staff. The facilities have to submit an attestation to the Department of Health by May 19th, 2020, stating that they have developed such a plan, and another attestation by May 26, 2020, that they have implemented the plan. As the governor shared, I had the privilege of speaking with Dr. Birx this morning to gain her insights and advice on our long-term care plans. She emphasized the need to test everyone, cohort appropriately, ensure infection prevention practices, and continue limiting visitors, and screen and test employees on a regular basis. Our psychiatric hospitals, with a census of 1,240, have tested 739 patients and 745 staff. The expectation is that universal testing of residents will be completed by May 22nd. All residents in the developmental centers have been tested, which is a population of more than 1,200. More than 2,500 staff members have also been tested, with the remainder of staff scheduled for testing over the following week. Several cities have stood up drive-through and walk-up testing centers. The department plans to support and increase testing in Elizabeth, Trenton, Camden, Patterson, Atlantic City, and Newark. This will be done in conjunction with a vendor to quickly deploy resources into our cities. Testing of seasonal workers in South Jersey has begun. 129 seasonal farm workers have been tested, 57 have returned as positive. Working with the federally qualified health centers, the Departments of Labor and Agriculture, a plan has been developed to test all seasonal workers, and 4 additional farms will be tested this week. Accommodations for quarantine have been made at the Field Medical Station and Salem Hospital. This is just an example of the work that has been going on since the beginning of the outbreak and will continue until we are satisfied that containment of this deadly virus is achieved. As testing of asymptomatic individuals increases, the need for contact tracers, as the governor shared, will increase as well. It is estimated that between 1,000 to as much as 5,000 may be needed. The ability to scale our contact tracing capacity is absolutely crucial. To do this, we're rolling out a plan that will leverage innovation, technology, and talent across the Garden State. We're planning to develop a community contact tracing corps. First, we will partner with the state's higher education institutions. Then we will expand our efforts to include all universities throughout the state. We will then estimate the demand for contact tracer capacity that could reach into the thousands, and we are announcing a request for quotes to solicit proposals from vendors, organizations, and institutions to help us increase the corps across the state. Our goal is to recruit culturally competent and multilingual individuals from communities across the state. The combination of expanded testing and contact tracing will increase our ability to quickly identify new cases and take immediate public health measures to interrupt the transmission of the virus. Now for my daily report. Our hospitals reported 4,328 hospitalizations, 1,306 individuals are in critical care, 75% of the critical care patients are on ventilators. The governor reviewed the new cases and deaths reported today. In terms of deaths, the breakdown of deaths by race and ethnicity is basically the same. White, 53.8, Black, 18.6, Hispanic, 18.8, Asian, 5.5, and other, 3.3. There are now 518 long-term care facilities in the state reporting COVID-19 cases. At the state veteran homes, among a census of 668 residents, there have been 363 residents that have tested positive, and there have been a total of 133 deaths. The veteran homes right now are under the oversight of the VA, the administration. Their help in education and training, administration and leadership has been invaluable. It currently numbers 105 strong. As you know, the National Guard has been supporting both the VA homes and the nursing homes in our state and are currently in 15 facilities. In addition to the VA homes, they are at Orchards at Bartley Assisted Living in Jackson, Bartley Healthcare Nursing and Rehab in Jackson, Greenwood House in Ewing, New Jersey, Deptford Center for Rehabilitation, Hamilton Center for Rehab, Landfair House in Wayne, Merwick Care Center in Plainsboro, and Abingdon Care Center in Greenbrook. At our state psychiatric hospitals, with a census of 1,240, 193 patients have tested positive, and a total of 12 deaths have been reported, similar to yesterday. In our daily percent positivity table in New Jersey, as of May 8th, the percent positivity was 23%. That concludes my daily report. Stay connected, stay safe, and stay healthy. Thank you.
Judy, thank you for all of the above and for your great leadership on both testing and contact tracing. And again, the last point on positivity, 23%, that continues to come down lately a few points a day. And May 8th is the last day that the specimen was collected. Just is that, have I got that right? That's correct, right? So we're also getting that turned around faster than we normally do. Thank you. Colonel, Nice to have you. Thank you for your leadership. Anything on compliance, PPE, infrastructure, other matters? Great to be with you.
Thanks, Governor. Good afternoon. Very briefly, just on a complete overview, there's been more than 3,500 law enforcement incidents since the first executive orders went into place. Of those, 262 of them have risen to the level of being an indictable offense. I thought I would just highlight that since for the past 2 months. With regard to the overnight, Newark issued 3 EO violations and gave 96 warnings. In Chester, a store owner was cited for having a pool and spa store open, which was deemed non-essential. In Irvington, a bar and restaurant owner was cited for being open. And in Lakewood, 3 different homeowners were cited for having large gatherings at their residence. And lastly, I just note, I think it was mentioned earlier in the week, but the Secaucus Field Medical Station is closing today. The 9 remaining patients there are being transported to the East Orange General Hospital, which was upfit by the Army Corps, which I think is a good indication and a step in the right direction. And we were certainly thrilled to have that medical station stood up. Governor?
Am I right in saying that that's going in storage, right? So
that is.
I hope we don't need it again, but we're preparing that step 6 in our road to recovery is resiliency, and that's part of it, right?
Yes, sir.
Yeah. Thank you for everything. I got a lot of feedback yesterday after your comments about the aberrant behavior at parks. I hope that we're able to make progress on that. And by the way, the weather is going to be getting warmer over the next number of days, so we need to remind folks that we're happy the parks are open, but please, please, please do the right thing. We're going to continue to have them at restricted parking capacities. Please keep a distance from each other. Please wear something that looks like this or some other face covering. I think that puts us in a really better, stronger place as it relates to public health. So thank you that. We're going to start over here. John, I need you to set an example because we got a lot of guys and gals here today who have questions. So I need you to keep this to a limit. I'm also going to be on with you later on today. Before you go, though, tomorrow we're going to be, Dan, 1 o'clock tomorrow. And I mentioned this. I've got nothing specific on this today, but, you know, going through the testing and contact tracing plan with you all today is intended to address explicitly. We go through the curves and the data every day. That's step 1 on the road to recovery. Testing is 2, contact tracing is 3. Judy alluded to 4, which is the isolation quarantining piece of this, and we'll give more details on that shortly. But I have also said that we would hope to be able to, assuming the curves continue to go in the right direction, we would hope to be able to, I would hope by the end of the week, maybe talk about some other steps that we can take gently to begin to reopen things. And so more on that. I don't have anything specific today, but more on that in the coming days. Again, tomorrow, 1 o'clock here, unless you hear otherwise. John, welcome.
Thanks. The first slide that you put up with the 6 measurements, is that the data that will determine dates, as you say? And if so, do you have the magic numbers or declines in new hospitalizations, patients in ICUs? You have numbers for that you'd like to make public? The contractor to help with contact tracing, what specific steps are you asking to maintain privacy of personal data to make sure that's not compromised? How much are the contact tracers going to be paid? And do you have an estimate for how much the total program will be? And
this is the last one, okay?
Sure. What does any of what you said today, tell people about when they can expect the reopening to happen?
Yeah, so John, I would say the following, and again, I think we run the risk of presenting an on-off switch, which is not going to happen. There's not going to be one magic day where everything is open. We're going to take a series of incremental steps. And so of that first chart, Danny, can we bring the first chart up, please? You're going to see that we're going to hang our hats. Judy, you tell me if you disagree. I'm going to hand this over to you in a second. The top 4 are the ones that they're in yellow for a reason, because we know to a person or to an entity as a ventilator that that's money good in the here and now. Again, new cases is clouded by the fact that we're expanding testing dramatically, and deaths, as tragic as they are a lagging indicator. I don't have a particular number in mind. I don't think Judy does either, for the simple reason of what I said a minute ago. This is not an on-off light switch. So this is not as though we're gonna hold back everything until we see X and then you'll get Y. We've already opened the parks. People can play golf. I hope that we could take more steps in the balance of this week, see how all that goes. I need not be reminded Memorial Day weekend is the weekend after this one, so the shore is going to matter a lot in getting that right. So we don't have a specific. I think the only data that I'm excited about is we get to 0 on any of this, but we're not going to wait until that to begin to take steps that we think we can take responsibly. Contact tracing, it's a good paying job. I think this is $20-something an hour. $25 an hour, I believe, to start. How much will the program cost? Hundreds of millions of dollars. I don't have a specific number for you, but hundreds of millions of dollars. And that's probably hundreds of millions of dollars, every 6 months to do both the testing and the tracing that we're talking about. Is that fair? I think I got what you asked there. Thank you, John. Elise, we'll go back to you.
Hi. With regard to the reopenings statewide, do you expect that it will be a fully regional approach? For instance, that you will say businesses and doctors' offices and workplaces in the north can open, followed by central, followed by south? Or would it be more of a statewide, okay, retail statewide can open, and then the week after that, okay, doctors' offices can open? Do you have any idea how that would work exactly? Thank you.
My pleasure. Thank you for asking. Judy, you tell me if you see this differently. We're not New York. Somebody reminded me yesterday that if you drove from New York City to the Canadian border, it's a 10-hour drive. It's hard to get more than a 3-hour drive in New Jersey. We're all packed in together. It's the densest state in the nation. And from a healthcare perspective, Judy's managed this brilliantly, I might add, but regionally. I personally am of the opinion that steps we take will continue to be statewide steps in terms of reopening. Now, some of them will be more deeply felt in certain parts of the state. An obvious one would be beaches, the extent to which we've got guidance on beaches. So clearly, overwhelmingly the shore, but we've also got a very vibrant, important lake community as well. But I think it's statewide, Elise, until further notice. But at the same time, unless you see this differently, at least as long as hospitals are in a crisis mode, and maybe beyond that, you're still going to keep in place the north-central-south protocol. Is that fair? Thank you. We'll stay in the back, and then we'll come back down to you, Dave, if we can. Thank you.
Hi, Governor. Good afternoon. I was wondering, based on what the Colonel said yesterday, and we've got a lot of parks and forests in the Pinelands, if you could explain the basis for keeping the park bathrooms closed. And given that many of them, including Batstow, are in very remote areas, what accommodations might be able to be made for folks who have to, unfortunately, go to the restroom while they're there and can't go anywhere else? And on the contact tracing, how are you going to balance perhaps HIPAA regulations and privacy rights? Let's say you run into someone who isn't cooperative. How would you handle that situation? And my final question was for the health commissioner. On Saturday, in reference to the developmental centers, she said that we're moving on to congregate settings. Could she explain what was meant by that?
I realized, John, that we didn't answer one of your questions. I was looking at my notes and couldn't understand it, which is the same one on privacy and HIPAA. Would you mind, Matt, addressing that out of the blocks in terms of, and Judy, anything you want to add? But I realized I forgot to answer that.
I apologize. I missed the question.
Contact tracing, how do you deal with matters of persons who may be worried about either a HIPAA-specific question or a data privacy, as an example?
Yeah, I'll let Dr. Tan actually take that question.
So,
Thank you for that. Dr. Tan.
So, whether it's for cases or whether it's for contacts, the privacy, confidentiality of health information is always paramount importance for public health professionals in general. So that's always, we're always, from a public health perspective, we always want to make sure that we ensure the confidentiality of the case patient as well as the contacts. That said, when you actually do contact tracing, you have to realize that contact tracing is a really specialized skill, and it involves a lot of training, and it involves also having talents in interpersonal cultural sensitivity, as well as an understanding and a flexibility to understand when you're doing an interview with individuals who might have been exposed to a case patient, to recognize those sensitivities and to build the trust when you're a contact tracer talking with a contact that this health information is not going to be revealed. In the course of routine contact tracing, the individual who is the case is never revealed to the contact. So again, that's why we kind of try to maintain, the distinction between the case interview and as well as the contact interview sometimes as well, to also further separate and to further to further stress the importance of the confidentiality of the patient information.
I'd say the other thing I would say, thank you, Christina. The other thing I was going to say is we use the word community to describe the group of folks that we want people from one's communities. We want to be as local, as diverse, as representative of the folks that they're phoning up or contacting. There's a staffing challenge on the bathrooms, which I want to make sure. There's also obviously a hygiene challenge. I think all of us, when we got the report yesterday, were a little bit taken aback, including the Commissioner of the Department of Environmental Protection, Catherine McCabe, who spoke to Pat on the way here. I think that's one where hold that thought. I don't have a crisp answer for you, but obviously the unintended consequence of people using plastic bottles is not an appetizing outcome. So bear with us on that. Judy, I think there was a question about congregate homes.
Any group home or congregate home where people can be together, whether it's in a kitchen or feeding, we're going to be looking at and consider that high risk. So we'll be testing throughout. And there's lots of them, by the way.
Again, I'm not sure you or I, sort of three hierarchies of groups of people as it relates to testing in plain English. There's the vulnerable communities, of which that is one, right? You then get the priority communities, and that's healthcare workers, first responders, essential retail, in that second category. And then the third category is the general population, symptomatic and asymptomatic. And so that's sort of I would hope folks would agree with the conclusion in a resource-constrained world, which opens up, the good news is by the day, that's the order of priorities I think that we all feel pretty strongly about, and that makes sense. So thank you. Dave, coming down to you.
Hi. So on the testing, how quickly do we think we're going to be able to get the results of these 20,000 tests a day by the end of this month? Because it would seem that if it's going to take days, that is going to dramatically lower the effectiveness of this program. And the other question that I have is on the contact tracing parameters. Let's say somebody tests positive. We're going to try to trace back all of their contacts. Does that include all of the people in the grocery store that they went to over the previous week, which could be 4 or 5 times? Do you have a definition of what contact tracing will be based on? In other words, is it you have to have person-to-person contact within a certain 2 feet without a mask? I mean, because it would seem like astronomically large, the number that would be needed of contact tracers, if it's something other than, most close contact.
Yep.
And final, if I may, antibody testing. It would seem it would be crucially important to be able to have a sense of how many people have antibodies for COVID-19, because it will give us some sense of how the parameters of the problem that we're dealing with when it comes to a flare-up.
Yep.
So if we don't have that, how effective do you think it's really going to be?
Yep. As the person least qualified to answer all these, I'll still give it a shot on each of them, Judy, and then I'll hand it to you and Christina. Remember when we talked about, Judy, when you and I hit spot positivity, that was as of specimens given on Friday, and we had Mother's Day and a weekend in between. So it was at one point we were sitting here, I believe it was 10 days to 2 weeks or more for the labs to turn these around. Am I right? And we're now definitively aggregating across the state a number that we can present to you with confidence at 23% from only 4 days ago. And that window, that time frame is going to continue to shrink. Again, I'll leave it to Judy and Dr. Tan to give more details. I think you're going to say on parameters, you have to have a meaningful interaction, and you've gone through what that means. But before you hand it off, I just would say on antibodies, it's the alluring test that we all are desirous of. It's the movie versus the snapshot. Again, remember everybody, if you get tested positive or negative right now, it's right now. The allure of the antibody is it's got your genetic history. You know whether or not, the allure at least is, at some point whether or not you tested. Whether or not you've got immunity, etc. The problem, and again, every single time you look at a study, you get closer to getting your arms wrapped around that, you realize that they're not reliable yet. And so the utility continues to be a lot lower than anybody would like. And that is a fact as a non-medical person. So having said all of that, to the two folks to my right, I guess the three questions is how quickly can the testing turnaround is going to continue to go down. It already has. What kind of an interaction do you have to qualify that you get the phone call? And any comments on anybody?
I'll handle the turnaround, and then Dr. Tina can handle the rest. We track that every day. I get a report every day. And at this point, it's 2.5 days turnaround. We get a report from all of the labs. So that's the average. Tina.
And what is the trigger for a person to get a call? You're identified as a contact. As the commissioner had mentioned, everything begins first with that positive test. Positive test means that you have a case patient. And, again, to recognize what the governor had started out saying about how much work these local health departments have been doing these last several months. It all begins with that local health department contacting that case patient to do an extensive interview to get a sense of who the contacts are. Contacts can include household contacts, occupational contacts, other contacts, where contacts are defined technically, either, again, as a household contact, intimate contact, or, our standard definition is looking at 48 hours before an individual becomes symptomatic, because we recognize that there might be a window when people are pre-symptomatic before they develop symptoms of COVID-19, where they might potentially be transmitting the virus. We look at 48 hours before when individuals are symptomatic to the point of the last time when the case patient actually might have exposed any other individuals. And it's pretty intense. These local health departments, they're asking, I'm going every day, every hour since that 48-hour, set point, every hour, who have you come into contact with those definitions of contacts? Those individual names are identified, then those are then presented to, whether it's in the local health department will then follow up with the contacts who are identified, and then the contact tracer will then say, you were exposed to a COVID case, and now here are the steps that you need to take. This is education on, what you need to do, for quarantine, to monitor for symptoms and so on.
I apologize, I got pinged. Did you answer antibodies or not?
Well, as everyone has alluded, what the antibody test can and cannot provide. The antibody test result will tell you whether or not you've possibly, whether or not you've been exposed to the virus, had the disease in the past. It doesn't tell you anything more about whether you might be immune to getting infected again with SARS-CoV-2, and doesn't tell you whether or not you might potentially be like a I'm losing my train of thought, but that's basically all the antibody tests can give you at this point. It could be helpful for characterizing the scope of disease in a community, because you get a sense of how many people might have been infected in the past, just to give you a sense of what the scope of the disease might be.
Tina, I go to ShopRite, and I have a regular experience in ShopRite. I'm not hanging with anybody for any amount of time, but I'm passing people in the aisle. I'm paying on the way out, and I test positive. Is there an attempt to go back and recreate who was in that ShopRite at the same time, or do you need a more meaningful interaction?
That's an excellent question. That's actually, we get that question all the time. We define the close contact is as individuals within 6 feet to at least 10 minutes exposure. So the casual, you're jogging by, you're at the ShopRite, very short interactions are not considered close contacts.
Thank you. That's, I think, we missed our buddy here. Brent, can we go to you in the back there?
Yeah.
This is the farthest you've ever sat from us. I hope you're not making a statement, but please fire away. Thank you.
Do you think recreational fishing charter boats should be allowed to operate before May 15th? Congressional Democrats are introducing a bill to provide aid to states and suspend SALT for 2 years. Your reaction to that? Any idea who will replace Lamont Repillette at education? And, where are all the testing supplies coming from?
This is a buzzer round. Nothing to report on recreational fishing. And if we have something, we will definitely let you know. We clearly support, I spent a long time on the phone with Speaker Pelosi on Saturday. We clearly support any bill with direct state aid that has the right formula, by the way, including our population and the burden of cases. And I think I might have been the first person that I know of, at least, to rally the troops around suspending the SALT cap. Lamont's done an extraordinary job. Rich, we're going to miss him like heck. He's a great teammate. He's been a great leader. He's richly deserving of this, and we've got no plans. I've got no news to report on successor. George, we got George Helmy here today, Chief of Staff, who's been working with Judy's direction on a lot of the testing side. Any comments on the supplies? I figure I'd drag George out of here.
Sure. So at the direction of the Commissioner of Health, we've really worked across the spectrum to secure both the kits and the swabs. So as the governor mentioned about a week and a half ago, we're expecting about 750,000 swabs from the feds, 550 kits. We've also worked across the spectrum of the labs to secure more. And obviously, as the governor and the commissioner mentioned, increasing Rutgers 5X will help satisfy that supply.
Thank you for that, George. Good to have you. Matt, likewise. Sir, do you have anything? You're good. You're good. Mike, is that you? I can't.
Yeah, that's me.
Mike, you're up, buddy.
Yep. Hi, Governor.
Hi.
I wonder if you could talk about, you've mentioned doubling the testing to 20,000 before, and you've talked about the means to get there, the partnership with the federal government and the Rutgers tests. Is there anything new that is leading to the state to get to the 20,000 figure, or are we today where we were, say, last week in terms of getting to that 20,000 figure? And then if you're listening to this at home and you hear we need to double the test, we need to get to 20,000, you get to 20,000 and then 25,000. What does that mean? Like, what does that get you in terms of public health, just doubling the tests?
Yep. Both good questions. Is there anything new? I think it's fair to say, Mike, on testing, there's something new literally every day. So I mentioned CVS, for instance, today. I believe I'm getting my drugstores mixed up. I believe I said 50 are going to come online. Am I right? 50 locations. Rite Aid came on. I pick up the Asbury Park Press today, and they had 11 or 14 new locations. There's something new every day. And we also, but I think maybe more strategically, we needed to present sort of the entirety of the picture for folks to understand not just more locations and more tests, but the mindset in terms of how we will go about this, especially as it relates to priorities. Again, vulnerable populations, high-risk folks. So this is up here as long-term care, as an example, one of many. Second group would be healthcare workers, first responders, essential retail, and then general population, symptomatic and asymptomatic. So the newness, I think, today is to be able to present, and Judy, if you disagree with this, jump in, the comprehensive picture, not just a one-off, we got this, we got that, but that all together, this is now, for lack of a better phrase, a symphony. And we would expect, as I mentioned already in my remarks, at least 20,000 by the end of May, at least 25,000 by the end of June. And that number, I suspect, will continue to go up as long as we need testing. Secondly, what does it mean? I'll give you my answer, and Judy and Christina should come in. It is intended, again, the vulnerable populations where we've been crushed, particularly long-term care. I think the need for universal testing of both residents and staff speaks for itself. So those are folks who are confined to those places. Other vulnerable communities would have a similar attribute. I don't think we need a whole lot of time on the rationale to get that population tested and retested, including the staff. I don't think we need to spend a whole lot of time debating whether or not we need to test healthcare workers as universally as we can, or first responders as universally as we can. I was on a law enforcement call last night, and I said that we had our 10th fatality due to COVID-19, and sure enough, I went home and got a text that there was another, not 2 hours after that call, Pat. So I don't think there's a real, it's the third category, Mike, that I think is the one that needs the most amount of underscoring in terms of why, and that is to give everybody watching and everybody out there the confidence that we've got the infrastructure in place so that as we begin to reopen this state, they know that we're on it. We can spot a community spread or a flare-up with very short notice, that we can then determine, as Christina went through, exactly who are the meaningful contacts that person has had, that we've got an isolation and quarantine, so that therefore that gives everybody in the state a kick in their step, a confidence to say, okay, when you had that in place, I feel, you know what, I'm good on going to the county parks. I hope we'll have guidance sooner than later on beaches that, you know what, I'm okay with that. That we've got a structure in place that gives you, everybody, the broad you out there, that gives all of us the confidence that as we open up, that you feel good about jumping in and taking us up on that opening. Anything you want to add to that? Or you good? Okay. Thank you, Mike. Paul?
I got two questions. One is legislative leaders, including John Bramnick this morning on a call, say they should be the branch of government holding the hearings on reopening and so forth, and he wants the Assembly to do that, and also making decisions on funding. It should all be, aren't these legislative functions in the long term? And we've already been in the long term here. And then you also yesterday said the benefit you get from another 2 weeks of remaining closed beyond the point you otherwise would have stopped is enormous. Well, does that mean you're going to keep extending for 2 weeks again and again until the virus goes away?
So, listen, I think we've done a good job, Paul, of keeping, by the way, Paul, you said my one-man show is getting tired, but you showed up today. I don't read your articles. I haven't done that for years, but I do read your headlines. I want you to know that I do pay attention, and I take some sort of affection from you that you would show up today having written that headline. Exactly. Listen, John and I communicate a lot. I think we communicate with our legislative colleagues a lot. In fact, I think George had a call this morning, and we invited all legislators in both chambers, both sides of the aisle, to walk through exactly what we've done today as it relates to testing. We have at least scheduled a leadership meeting tomorrow to talk about budget and funding and appropriations. We had a call, I think, Saturday morning, am I right, with legislators. You all join me with that. I think the communication is high, and I think the respect for what they bring to this versus what we may bring to this is nothing but what it should be. So I'll hopefully get a chance to connect with John and get more on that. The benefit, Paul, no, not that it's an unending extension, because we're going to, as I said, by the end of this week, that I would hope that we're going to be able to take some more steps. What I meant was, as a purely health matter, if you look at the models that Judy and Christina and others on the team look at, and you stop at any moment in time and you lower your guard on social distancing, by the way, not because we're sloppy, but because we made a decision that we're going to open up whatever it is, beaches or whatever it might be, and you compare what the health reality would have looked like if you had stayed with that another 2 weeks, that you had not done that, it is a dramatic difference. So all I'm saying is, again, we're not myopic on only the health piece of this, but we are obsessed with the order of events, which is public health creates economic health and not the other way around. And so there's an enormous public health benefit to staying the course, not indefinitely, I'm not saying that, and not Groundhog Day every 2 weeks you get another 2 weeks, but at any point in time, whatever action you could take that day versus 14 days later, you get an enormous public health benefit from that. And that's something that we pay, Judy, I don't want to put words in your mouth, and Christina, but that's something we pay very, very close attention to. Because if we can bring this sucker as close to zero as possible, we have advanced ourselves enormously, not just in public health, but in economic health. Thank you. Daniel, good afternoon.
Governor. 2 questions. So first, do you expect the Jersey Shore economy this Memorial Day weekend, local businesses and local towns and the economy to take a financial hit during Memorial Day? Just all the retail is closed, hospitality, food and industry, the guidelines still aren't out, the beach guidelines. And second, just coming at the heels of the EDA board meeting today, you proposed the 5 tax incentives back in 2018, and there's been the push and pull with the GROW and J&R. Is any of that still feasible during the recession, or are all those incentives just totally out of the window and not at all happening?
Yeah, man, I would say, Daniel, on the first point, I don't know what part of America is not going to take an economic hit in the month of May. I literally don't know where in America is not taking an economic hit. So this is not just New Jersey, and it's not just the Jersey Shore, but as a country, we're getting clobbered. Now, are we going to have in place, in my humble opinion, and again, bear with me because I'm not ready to go live with this, can we take some steps that will mitigate that hit? And as I mentioned the other day, it won't be the old normal, but can we get some semblance of a new normal on the shore by the time Memorial Day weekend comes around? I'm going to say yes. But that's not going to say, that's not to say that we're still not going to take an economic hit, that stuff still won't be closed. And my heart is broken over it, but again, that's not unique to the shore. That's everywhere in the state, everywhere in this country. And we're trying responsibly to take, again, public health creates economic health. We're trying to take the steps as responsibly as we can to get as back as fast as we can. But everyone's taking a hit. Yeah, the incentives, I think they're still as relevant today as they were then. I think I'm not patting myself on the back because it's a team effort. I think that it's a package of really smart incentives, and in some cases that set a bar unlike any other American state. The Evergreen Venture Fund is a unique animal in America that I think would have huge implications for our innovation economy right when we need them. So I'm sticking to them. Thank you, sir. You're good. You just came to sure. Good to have you. So to each and every one of you, we gave a lot out there today. I recognize a lot of dense material, especially on contact tracing and testing before it, and we're happy to follow up, obviously, on anything that comes out of it. The points I want to conclude with as I mask up are ones, first of all, I want to thank Judy and Christina for their extraordinary work, and their colleagues. Pat, likewise to you. Thank you to Jared, George, Matt, and the whole team who are here today. I just want to repeat very briefly, a couple of points. Again, I think what you heard today is we're getting to a critical mass on testing. We've got a contact tracing plan in place that is real, beyond the extraordinary work that's been done at the county level over the past several months, and that we've got a very clear set of priorities. And their priorities, I hope that you would recognize and share with us, which is vulnerables, high-risk population, general population. The capacity is coming up such that it won't be one versus the other, but over time we're going to be able to get to all three of those populations. And I want to give Judy and her team a huge shout out on both that and contact tracing. So that's one. Number two, the weather's getting pretty good this week. Please, everybody, we know you're pulling your hair out. Please stay the course. It is working. And it's because of you that we've been able to make that progress in that first slide that we put up today that's been so enormous since the peak and even over the past couple of weeks. And then thirdly and finally, we'll have some more guidance as the week goes on. Not today, I'm not sure tomorrow, but we're going to have some more guidance. And again, John, to your question, it's not going to be, if we get X, we're going to flip a light switch. It's going to be, I hope, a series of incremental steps that we can take responsibly based on the health data. Again, public health creates economic health, and that's the order of events that we're going to stick to. Thanks, everybody. God bless you all.